Today, we're speaking with Dr. Michelle Cameron from the Oregon Health and Science University. Michelle, thank you very much for sharing your time and expertise with us for this eMultiple Sclerosis review program.
You're welcome. It's a pleasure to be here.
So we're going to talk a little bit about cannabis-based therapies, specifically for MS-related symptoms like spasticity. Certainly in my practice, there is a lot of patient interest in cannabis-based products, and I would say a lot of perceptions that sometimes are accurate and evidence-based and sometimes are not. And so I'm wondering what your experience has been with patients seeking treatment with cannabis-based products for MS and how you counsel them.
Sure, happy to answer that, Michael. So in my experience, and here we are in Oregon where cannabis is ubiquitous, many of my patients ask me about cannabis, and many are probably using and not asking me about it. So the first thing I counsel them is, please discuss this with me. I do actively ask them. I don't wait for them to ask me. And then I share with them what evidence we have, which is actually pretty substantial. We have pretty good evidence that certain cannabis-based products do reduce patient-reported spasticity. The effect is modest, however, so this isn't the miracle drug. And it reduces patient-reported spasticity. It hasn't actually been shown to reduce objective or clinician-measured spasticity. And then I think most important for them is not to forget that there are side effects. The side effects are some that they might expect and some that they might not. They probably expect to feel a little sleepy or a little off balance, or maybe nobody's thinking is better when they use marijuana than it was when they didn't. So those are all expected. They may not realize that if they have cognitive problems from their MS, this might actually make them worse. They might not realize there are interactions between cannabis or cannabinoids and there are other medications. So that's part of why we need to know about it. And then I think they may not realize that whether it's called medical or not, it may or may not be okay for their employer. So think about you and me. If we use cannabis and we get drug tested, at least for me, I would lose my job. And so they're a truck driver, etc. Just because it's medically legal in your state doesn't mean it's okay. And then last of all, to recognize the difference between the federal law and state law. Might be fine by state law in their state or not, but it's still not okay by the feds. And I think that's it.
So that is a fantastic summary of some of the most important points to discuss with patients. So thank you very much for that insight, Michelle.
You're welcome.